Now, scientists are scouring Cape Town's dirty underbelly for drugs, bugs and diseases. Wastewater surveillance has helped researchers track a rise in codeine and opioid use in the city during the pandemic. The South African Medical Research Council has also been able to monitor COVID-19 infection rates in communities. Monique Mortlock takes a look at how the process works.
Every time you flush or wash, you are doing your bit for science. And the water we see as dirty is liquid gold for scientists monitoring disease outbreaks like COVID-19 in communities and even the type of drugs people are using.
Ulrich van Zyl from Stellenbosch University's microbiology department collects wastewater samples twice a week. He gets them from 4 different wastewater treatment plants across the Cape Metro and Stellenbosch.
The composite sample you take 10 millimeters every 10 minutes for a 24-hour period, so you have a nice representation of all that goes on in a certain community for a 24-hour period.
A drop sample, on the other hand, provides data only for a certain time of the day. Sampling also takes place at Stellenbosch University's different campuses for COVID-19 research. This one comes directly from the sewer.
This was a way in trying to promote or give additional information to our campus health sector by showing what the prevalence is of the viral RNA fragments in the sewage coming from defined communities or student residences.
The samples from the treatment plants and the sewer lines go to the Medical Research Council's labs. Here, it will be processed and tested for non-viral COVID-19 fragments. Wastewater surveillance has also been a useful tool to monitor illicit drug use in Cape Town and Stellenbosch, the only areas in the country where this is done. Before the pandemic, researchers observed a spike in the use of party drugs like ecstasy and cocaine over weekends and a drop during the week.
That kind of pattern changed quite significantly for the recreational drugs during the lockdown period, where that recreational weekend spike wasn't observed during harsh lockdown periods, which is expected. So there's a lot of studies overseas also clearly indicating a higher usage of over-the-counter or other prescription drugs, opioids especially, where we also started seeing that there's slight increases in codeine levels in the wastewater compared to previous years.
Archer, who's part of a European sewage analysis network in which he shares data on illicit drug use in the Cape, says the possibilities of wastewater epidemiology are endless. Monique Mortlock, Cape Town.